Valentine's Day is coming up, guys. So I wanted to talk about something people often just whisper about and almost nobody really explains well. That is low desire, low libido. And here's the part that surprises most people. Libido is not just about your hormones. It's actually driven by the brain first, and hormones respond to that signal, which is why PT-141 is so incredibly fascinating. PT-141 is also called Bremelanotide. It's an FDA-approved peptide for low sexual desire in premenopausal women. It's also been studied in men for erectile dysfunction. So what makes it different? Well, it doesn't work like Viagra. It works on our melanocortin receptors within our brain, particularly our hypothalamus. Melanocortin receptors are like tiny communication switches on nerve cells that help control things like our appetite, energy, or circadian rhythm, mood, sexual motivation, and different types live throughout the body. But the ones PT-141 targets is the melanocortin receptors 3 and 4, and they're mainly in our brain. Now that area talks to your pituitary, your ovaries, your testes, your adrenal glands, your emotional centers. Translation, well, desire is neurologic, hormonal, and metabolic. It's not just about the plumbing. And that's why this peptide can sometimes help when blood flow meds don't, especially in those with diabetes and vascular problems. Now, let me be very clear about something. I absolutely love peptides. They can be incredible tools, but they work best when the terrain is right. Because if sleep is terrible, stress is through the roof, iron or B12 is low, thyroid signaling is off, blood sugar is all over the place, no peptide is going to fix that. That's just root cause medicine. Now, let me add the part I don't hear enough people say out loud. With this one, let me tell you, less is more. This is not a go big or go home peptide. Now, ask me how, okay? It's because I personally have tried it, and when you overdo it, your body sends you a memo, let me tell you, and that memo is nausea. Not cute, it's not romantic, and it's not part of the plan, which is exactly why this is something you respect and not something that you just mess around with. Yes, when it works, let's just say that spark comes back and somebody's canceling their Netflix plans, okay? Facts, y'all. So, which is why so many women in their late 30s, 40s, postpartum, perimenopause, all those seasons where desire quietly diminishes and disappears, become really curious about it. After babies, sleep deprivation, hormonal shifts, mental load, stress, metabolism changes. I see that every day, and honestly, I get it. But I care way too much about people to pretend this is something that you should just grab off the internet and experiment with. The most common side effects are nausea, number one. You might feel flushed, headaches, injection site reaction. And this isn't for everyone, especially those that may have uncontrolled blood pressure, major heart issues, or advanced kidney or liver disease. This is peptides. These are signaling molecules, and it deserves respect. Everyone wants a shortcut. I care about long-term physiology. Desire isn't broken. It's usually responding to stress, hormones, inflammation, metabolism, nervous system overload. And peptides come after we understand that picture. That's how functional medicine thinks. If you want more science without the hype, guys, follow along for more root cause reality.